Now, each of you provided to the committee information that relates to certain medical conditions that automatically triggers an investigation into possible grounds of rescission. Mr. Sassy, I left off with you. You had 1,400 different conditions that automatically triggers an investigation. Mr. Ham, on behalf of Assurant, there are 2,000 conditions that trigger an investigation that you provide to the committee. These include breast cancer, ovarian cancer, and brain cancer. Why does cancer trigger an investigation?
What triggers the investigation?
No, why does cancer trigger an investigation?
I will answer. What triggers the investigation are the types of medical conditions of a chronic nature where there's a high probability that the condition would have pre-existed at the time of the application. It is not based on the cost of the claim. It's based on the medical condition. In fact, the people that make the rescission decision are not aware of the cost of claim. It's all about
if it's the medical conditions. If it's the medical condition, then before you sign them up, why don't you get all the medical records? Why don't you find it then? Why do you wait until there's a claim?
If we were to receive all the medical records at the time of application, that would delay the process significantly, delaying people's access to health care, and it would add a tremendous amount of cost to the product. The vast majority of applicants provide all the information that's asked for at the time of application.
So it's a cost issue. It's too costly to get the medical records.
It would add to the, yes, it would add to the premiums that our customers would pay by a significant amount.
So what does it cost, $40 to get medical records?
I'm not familiar with the cost, but it would also delay the process.
But it wouldn't be better to delay the process to make sure a person's insured as opposed to pulling them when they're going through cancer like Mr. Raditz?
The vast majority of our customers provide the appropriate information.
So did Mr. Raditz, but you still denied him coverage, right?
I unfortunately cannot comment on that particular case.
Well, Mr. Collins, in asking the same question of United, you insisted that you also use a computerized system to identify cases to automatically investigate for possible rescission. But there was no one at your company who knew how the computer decides which files should be reviewed. So is it the case that United has put the decision of which patients will have their health care treatment interrupted by a rescission investigation in the hands of a computer that no one understands?
No, sir, that is not true. I haven't really been privy to the discussions between my staff and your staff on this issue. We've been trying to come to an understanding about how to best provide the data in a format that's easily understandable. But let me just say...
Well, can you tell us what conditions the computer considers for a possible rescission investigation?
No single factor is used in our process to trigger an investigation. So we look at, the system looks as it's screening claims that come in at the effective date of the policy, the effective date of the procedure, the severity, the type of service, and the diagnosis code. Those are all factors that go into the algorithm that pulls cases out for screening.
Well, the algorithm, no one from your company could tell us. Will you commit to us today to produce whatever witnesses or documents are necessary to explain your algorithm, your computer selection process? Could you do that? Will you commit to do that for us?
Yes, sir. We are.
We're still trying to figure it out.
We are trying to put it in a format that would be acceptable to the committee, sir.
Dr. Politz, Professor Politz, do you see a common thread here among the conditions? I mean, you got 1,400 conditions, 2,000 conditions in the computer that it can't explain that does rescission. Why do you think they have all these rescissions?
I think the common thread is that if somebody makes a claim for anything serious in their first year, there is an opportunity to go back and review the entire transaction to see if it's going to be withdrawn. I think that's just the common transaction. And I think it is not consistent with your federal law. And whatever else you may do going forward.
But as to the HIPAA law, basically we leave it up to the states, and then HIPAA has to be enforced by the federal government, CMS, right?
That is correct. The ultimate enforcement.
So the value of the law only depends on the enforcement of the law.
Yes, it does. And there is a fine of $100 per day per affected individual for noncompliance with the law that can be levied.
Let me ask each of our CEOs this question, starting with you, Mr. Ham. Would you commit today that your company will never rescind another policy unless there was intentional fraudulent misrepresentation in the application?
I would not commit to that.
How about you, Mr. Collins? Would you commit to not to rescind any policy unless there's an intentional fraudulent misrepresentation?
No, sir. We follow the state laws and regulations, and we would not stipulate to that. That's not consistent with each state's laws.
How about you, Mr. Sassy? Would you commit that your company will never rescind another policy unless it was an intentional fraud misrepresentation?
No, I can't commit to that. The intentional standard is not the law of the land in the majority of states.
What do you think? It's fair to rescind somebody for an innocent mistake?
Well, I think applying a knowing standard is a much more objective and accurate
Well, our first panel,
standard to
none of them
apply.
had any knowledge of it, and they were all rescinded, right?
I'm sorry.
Our first panel, none of them knowingly made a misrepresentation, but they were all rescinded. Their policies from Ms. Baton all the way down to our witnesses there. There weren't material misrepresentations, right?
It's our policy if we determine that the applicant did not know about a specific condition, we would not rescind.
Okay. So like Ms. Horton there, you wouldn't have rescinded her, but
I can't speak to the specifics of Ms. Horton's case. I am not familiar with the specifics. I'm sorry.
Mr.